about today, we're focusing on human capital and productivity. And I know that everyone in this room is probably passionate about this. And we may be looking at it from different perspectives. We might have education sector people, health sector, people in employment and employability, labor. But I think that the idea is that we're all passionate about productivity within the context of this country. A lot of numbers, have been shared since the first session in the morning. We know that it is projected by the year 2050, Nigeria will be about 400 million in size, and that the bulk of that number will be aged 15 to 64, i.e. will be people who are supposed to be working in some way, or who can work in some way. And so when we think about the reality of that, and then juxtapose that with the context in which education and skills development currently occurs in the country, we realize that we do have a bit of a way to go. And so I think that the essence of this workshop is really for us to begin to get a bit more practical about where we're going as a country in the year 2050, what the key productive sectors in the private economy or in the private sector will be. And then asking ourselves, how do we accelerate the progress of these sectors? And we're going to be breaking into our groups and we're going to be discussing this issue. But I think what's really important for us to remember is that, one, there is no right or wrong answer. What we're bringing to the table in this discourse is an innovation mindset. And of course, with an innovation mindset comes a bit of disruption, which means that we're probably going to be thinking a little bit out of the box. And what we're trying to do is to design solutions. Of course, we know that designing solutions also involves discussing problems a little bit. But it's really focused on, if we're to accelerate the progress of the private sector in Nigeria today, what do we need to focus on? And so, within the context of this particular workshop, we're going to be focusing on employability and skills, and also health and well-being.
Yeah, so how can the private sector leaders, help in improving workforce productivity in Nigeria? So the first key points that we touched on was on businesses need to be more involved at the university level. And that fits into the next key point. So there has to be a partnership between the government, between universities, and between the private sector, so that the curriculum is shaped in such a way that the universities are producing graduates that are ready, to take up jobs in the industry. We touched on parents, the need for parents to stop interfering with career choices and career decisions that young people actually make. So when I was growing up, for example, it used to be engineering, law, medicine, or accounting. So the point here is allow your children to have that flexibility, or for private sector leaders to let young people actually have that flexibility to make their own career decisions. Another key point was to reorientate and ensure that there's a mindset makeover for young people, because a lot of our young people nowadays, everybody wants to drive Benz before they are 25 or 30 without actually getting the job done. So there are loads of job opportunities, for example, in the farming or agricultural sector that people are not actually taking up on.
The main issue that we discussed is the fact that there is a very big mismatch between what the employers want in terms of skills and what the school system is supplying. There's a very big mismatch. And how do we solve that problem? By working with the private sector, and also by understanding the labor market in a very granular way. Granular meaning to say detailed way, more detailed than what we do in national household surveys, which does not guide the providers of services as well as the students to choose a career. What we discussed is the fact that the traditional way of classroom, 40 students, 80 students, will not do the trick. We have 400 million Nigerians in 2050. Therefore, there must be a new way. And the new way that's identified by the group is using digital technology, online courses. Almost everybody has a mobile phone. Happily, the mobile phone now can also be used as your teaching material or teaching methodology for scaling up, upskilling, and reskilling the workforce.
But I think one of the things about our group is that we focused on a reframing, right? First and foremost, we focused on how do you reformat, reframe the conversation about healthcare. We usually talk about infectious diseases, immunizations, death at 40, 50, all very important, but reframing healthcare not just as the absence of ill health, but the complete state of physical, mental, and social well-being. And that drove everything else we talked about. I think as we focused on that and drove a little bit further, we really realized that it's not a conversation when you go to the National Assembly or you go to PwC or you go to Shell, Total, Mobil about give us more money. It's about you're already losing billions of dollars a year because the people are mentally ill, right? They have hypertension, they have diabetes. They're leaving your workforce after you've put in millions of naira of training them and they have a stroke at 45. Right, a managing director has a stroke in an oil company at 45, that company has lost at least $5 million on their training, right? And so reframing that to legislators as a policy statement, that this is not just a conversation about improving health, but reducing the lack of spend that we have when healthcare is not engaged, right? And then we talked about a host of things that we think should be investments because we think of healthcare as an investment. It's no longer spend. It's not, oh God, I have to pay another $10 a month on this person's healthcare. No, it's the investment in healthcare. And some of these things are National Health Network, health insurance, immunization, really summed it up like this. And I like this because your group already focused on it. And I think if you're having a conversation, if there's any one takeaway from this, our accelerators, is that technology drives everything we're talking about in this room. If our nation does not invest in the critical infrastructure of technology, be it improving of our 4G network, be it investment of the future 5G network, everything else here falls apart. It doesn't work. We can't do it on 3G. Right, or HDSA speed anymore. Whether you're going to do research and development, whether you're going to do Coursera, whether you're going to do telemedicine, whether you're going to enhance, enable, and catalyze the primary healthcare network, enabling immunizations and improving school health, it has to be done with technology as the core or everything falls apart. And so for our group, health and health and wellness, at the core is technology, and that's all I got. Thank you very much.